Good morning, my name is Rachel Phelps and I am a nursing graduate student at the University of Maryland in Baltimore. This morning in lab, I'm going to teach you how to give an intramuscular or IM injection into an adult client. So at the end of this presentation, you should be able to state the different parts of a syringe and needle. Also, you should be able to identify the different needles, syringes, and angles for giving an IM injection. And lastly, you should be able to list the 3 different muscles that we use to give an intramuscular injection. So let's talk about the different parts of a syringe and needle. First of all, in your upper left-hand corner, there's a picture signifying the different parts of a syringe. The first part is the plunger, which is a movable part allowing one to draw out the medication. Secondly is the barrel, where your medication is stored until you give the medication. And at the end of that is called the needle adapter, where your needle is actually screwed onto your syringe for the injection. So let's talk about the different parts of a needle. Again, the needle actually comes in a protective cover that's protecting you while you're screwing it onto the syringe from being stuck. It's usually just simply a cap. The first part of the needle is the needle hub, which screws into the needle adapter of the syringe part. And then the long piece of the needle is the shaft of the needle, and at the end you'll find the bevel of the needle. So where do we actually give an IM injection? We actually give it into a muscle, into one's muscle at a 90-degree angle, signified by this picture. 90-degree angle meaning up and down. You want to make sure you go through one's epidermis, dermis, subcutaneous tissue, and into their muscle. You're actually going to get this injection all the way into the muscle. So let's talk about the different sizes of needles and gauges. First of all, you want to pick a needle from a 1 to a 1.5 inch, gauge 21 to 23. Based on your client, if you have a small elderly client whose arm is much smaller, you'll typically want to pick a 23 gauge needle, 1 inch. 1 inch would probably get that into the muscle. If you have a bigger client who's more muscular, a guy or girl that's more got a little bit more muscle in their arm or in their other sites to give injections, then you may choose the 1.5 inch, maybe 21 or 22 gauge needle. So these gauges actually are a little bit tricky. You would think that a 21 gauge needle would be a smaller needle versus a 25 gauge. You would think it would be bigger, but it's actually opposite. So the smaller the number, the bigger the gauge of the needle, and the bigger the number, the smaller the gauge of needle. So just keep that in mind when you're looking at your clients and trying to choose which gauge to pick. So there's 3 muscles you can actually give an IM injection into, and the first is the ventrogluteal, the second is the vastus lateralis, and the third is the deltoid muscle. So we'll go through each of these. Keep in mind that the deltoid muscle is the smallest of the 3 muscles, and it can only hold up to 2 mLs of medication at a time. So you typically give anywhere from 1 to 4 mLs of medication, and just keep in mind if you're giving more than 2, you may want to pick the ventrogluteal or the vastus lateralis site. So first, let's look at the ventrogluteal on the right hand side of the screen. For y'all is a picture, and typically you use the palm of your hand to locate the greater training core of the femur. You spread your index finger away from your middle finger as signified here, and posteriorly from the anterior superior iliac spine to the furthest point possible, and then you inject where the X is. I've also created a handout for each of you at the end of class that you can take with you. And there's a couple of YouTube videos for each of these sites that you can look at in your free time, and it'll kind of give a better explanation. The second muscle we're going to look at today is the vastus lateralis. It's using the outside portion of a person's thigh from the knee to the hip. You want to divide that into thirds and give the injection in the middle third. The final muscle, again, is the deltoid. In the deltoid, we use the acromion process, which is the end of the shoulder bone. Essentially, you want to put your index finger on that and then count down to about your pinky or your third finger, giving the injection into the deltoid muscle. So let's talk about the supplies you'll need in order to actually be successful giving this injection. First of all, you want to have a syringe and a needle, which we've talked about, choosing again the appropriate needle size based on the client you're going to give it to. You want to have a blunt needle to draw up your medication. Make sure you have your medication at hand. And make sure you have a Band-Aid, alcohol swab, gloves, and you want to make sure you have access to hand sanitizer and a sharps container. And then we're going to use an orange today because it signifies the closest thing to a human arm or human leg to give an injection into. So I'll walk you step by step of how this actually goes, and then I'll show you a demonstration at the end of the step by step. So first, again, pick your appropriate syringe size based on the amount of medication you're giving. Syringes usually come 3 milliliters, 6 milliliters, etc. Make sure you have a blunt syringe, or excuse me, a blunt needle to drop your medication. And then we're going to pick our appropriate needle size for injection, again, based on our client. With the elderly client, we're going to want to pick a smaller inch size and a smaller gauge versus a more muscular client. We may go for a 1.5 inch needle size, inch-wise, and then maybe a smaller gauge needle, or bigger gauge needle rather. So make sure you have your alcohol and your Band-Aid. You're going to go into your patient's room, wash your hands, go through the 5 rights of medication, and draw up your medication. Using your blunt needle to start with, you want to make sure that you always use the blunt needle to draw up, because you never want to use the needle that you're actually injecting into your patient to draw up the medication. So once you've done that, remove your blunt needle, place that in sharps, and obtain the actual needle you're going to use for injection. Want to make sure that you clean the patient's site from the inside to the outside with an alcohol swab, and then you're going to actually spread the person's skin. Instead of pinching up, you want to make sure you're spreading it taut using your thumb and index finger. Just spread it straight out, and once you spread it, you want to give the injection kind of in the middle of that area. And then you want to inject into the patient's skin. You want to aspirate per hospital policy. Some hospitals don't require aspiration, so if that's in your policy, just make sure you know that. Aspiration means just pulling back a little bit on the plunger, making sure you don't see any blood. If you do, you're in a blood vessel, you need to immediately remove your needle and find a different site. If you've aspirated and you don't see any blood, you want to go ahead and inject your medication slowly, remove your needle rapidly, and then you want to safety cap it. And I'll show you that in the demonstration. It's usually just a little cap you put over the needle at the end to protect you from re-sticking yourself. Place a Band-Aid over your client's arm, and never ever ever massage the site once you're done. You want to make sure you just give it, let it rest in the patient's muscle. Put your syringe and needle in the sharps container, remove your gloves, and wash your hands. So at this time, I'm going to actually show you a demonstration. So if you want to come around the table so you can get a better view, that would be perfect. Okay, so at this time, I'm going to show you a demonstration of what we talked about with the step-by-step. So if you guys want to come around and circle up so you can see a little better, get a little closer, that would be perfectly fine with me. So we have all of our needed supplies. First, again, we want to obtain our medication that we're going to administer into our patient. We want to take all the supplies into the room. For this demonstration, we'll just draw up 2 mLs with our blunt needle, and I'm going to use the 23 gauge 1 inch needle, assuming that our client is an elderly patient with a small arm. Taking our alcohol swab and our Band-Aid. Most rooms already have sanitizer, gloves, and a sharps container. So go into the room, tell your patient what you're doing, go over the 5 rights of medication administration. So we're going to wash our hands. And don our gloves once everything's dried. Some medication bottles will have a little cap over it, so you can take it off. If it didn't have one, you would want to clean the top with alcohol. So prepare your supplies. Again, we're just going to draw up 2 mLs today to give to our patient. So I use the 3 mL syringe. Typically, you pull back how many mLs you want to use of air and push it into the medication, and then draw back how much you're using. If you had any air bubbles, you would want to get rid of those. And then you want to get ready with the needle gauge in inches appropriately of choice. Prepare your Band-Aid for your patient. This is the safety cap that I was telling you guys about, so I'll show you how that works in just a second. Prepare your client by cleaning from inside to out with alcohol. We'll say we're using their deltoid muscle. Again, you want to spread your fingers out and inject quickly. Pull back, make sure you're not in a blood vessel. Inject the medication slowly, remove your needle rapidly, and then this is the cap part to your needle. Put your needle in the sharps container cover your patient's site with a Band-Aid. Remove your gloves, clean up your supplies, and wash your hands with hand sanitizer again. Okay, so now that you've seen a demonstration, let's just review the 3 appropriate sites to give an IM injection. Again, are the vastus lateralis, the ventrogluteal, and the deltoid muscle. You want to always give an IM injection into a muscle at a 90-degree angle, remembering to pick your needle size appropriately, anywhere from a 1 to 1.5 inch 21 to 23 gauge needle based on your client. Again, if you have an elderly, smaller client with a frail arm, you want to use maybe a 23 gauge 1 inch versus a big muscular man or woman. You could use the 1.5 inch, maybe 21 or 22 gauge. So at this time, we're going to practice. If you guys want to pair off into partners, first go around and try to find the different muscles on each other, the 3 different sites, and then we'll pass out oranges and supplies to practice actually giving an IM injection. Also, at the end of class, don't forget I've got handouts for you guys to take with you. Again, there's a couple video clips about the different muscles on there as well and how to find those. If you guys have any questions, just let me know, and I'll be coming around to help with anything you need.